You know, we really found that there were some lapses that created the problem that these two nurses have now, become infected. But I would have to say that, for many years we've had very good infection control and prevention procedures. I think Ebola has created some challenges that now, we've really learned very quickly. The American Nurses Association has been in touch with the CDC on a regular basis. There was a conference call yesterday with more than 6,000 nurses dialed in to express our concerns that we really believe there needs to be greater clarity and I think of stepping up of the level of protective equipment that's recommended. As we know, it's really important to understand how to put on and take off this equipment. We are assured that there are plenty of supplies nationwide, and so we're really encouraging our nurses to work very carefully and closely with their organizations to make sure that they have adequate training, they have the supplies, and if there's any concerns, to raise them quickly and have those resolved.
And one of the things that, and early on, we chafed a little bit at the CDC director in saying, well, we had some very obvious protocols and obviously they weren't followed. Did that rub you and people in your profession the wrong way? Because that obviously was not, I don't know what he was trying to do with that. Well, I guess I know what he was trying to do, but I thought it was kind of disingenuous and not a good way to start things off.
There's been a very strong movement in healthcare for more than a decade to really create a culture of safety. And part of that means that there is no blame. We look for system problems and we correct them. So I think there was some disappointment that some of that language sounded like there was blame being placed. But what's most important is to learn very rapidly, correct the problems, make sure we spread the information about what are the best practices, and in this case it's really rapid identification with screening tools and the right questions and vital signs to be taken when someone comes to an emergency department. Have they traveled from West Africa? Have they been in contact with anyone known to have had Ebola or exposure? Do they have a fever? What other symptoms they have? And then to move into a mode where if someone is identified, they're quickly put into isolation, and then we follow them and move them to a higher level of care. And so I think those are the kinds of things that we're really focusing on, knowing that education is very important, and then particularly the actual protection of workers with the ability to understand and practice and have a buddy system to know that they're putting on protective equipment appropriately and then taking it off, because that's where we think there were problems with these two healthcare workers becoming infected.
Pam, how confident do you feel that we know how to handle the waste that is generated by Ebola patients, that we know what to do with anything that comes down the line? Are there other problems in the system that worry you that you think we haven't addressed yet?
Actually, there is a lot of information available from the CDC on these issues, such as dealing with laboratory specimens and waste management. Again, I think the fear factor that was raised created a fair amount of chaos early on. And so, individuals or companies that have not been accustomed to how to deal with waste management said, no, we're not going to handle it. And some of that also happened within institutions. I think we have very clear direction on those activities right now. And so there's incineration going on, there is disinfection going on. We also have great information from places like Emory and Nebraska and the sites that have a lot of experience handling these kinds of issues. So again, we have that information available to our hospitals, and we're working closely with the American Hospital Association as well.